Although government and bureaucratic insurance companies dominate American healthcare, there are still a couple tiny areas where the free market rules because the patient pays directly. Our special correspondent Kennedy visited a cosmetic dermatologist and a LASIK eye surgeon.
Right to the left, right.
We have to provide excellent quality service to be competitive because our patients who are self-paying in the free market, they don't want to wait an hour to see your doctor.
What are the benefits for not having to go through insurance companies?
Enormous amount of paperwork that's required before and after. We don't have whole departments dedicated to insurance companies.
Since he competes against other LASIK surgeons for patients, he needs to have the best equipment.
The patients are quite savvy, so if it's not the advanced femtosecond laser, they're going to leave. It's a Google away to see what the best is.
Technology is new. When I graduated from residency, we had one laser, one filler, Botox wasn't even approved. This is just in the last 15 years that we have all these products.
This is a cosmetic dermatologist. She must have the latest equipment to attract and maintain customers.
I happen to have 14 different lasers. I've bought them all. There's new resurfacing lasers and tightening lasers.
And to keep patients, both of these doctors are very accessible.
Do you give your cell phone number to patients?
My patients have my cell phone, they have my email address, and I try to be accessible at all times.
We have office hours Saturdays. We operate till 7 p.m. We have a doctor available 24/7. We have to be great to be competitive.
It sounds nice. Most of you, I bet, don't have such good care or they don't make themselves available that many hours.
When's the last time you high-fived your doctor? Seriously, how many people go around doing that?
All right, but this is LASIK eye surgery, cosmetic surgery, elective stuff, mostly for wealthier people. This doesn't take care of the big stuff.
No, this is elective stuff that works, and people find a way to pay for it. And I have to tell you, like, this free market system, this model, I wish it were applied to other areas of medicine, because the doctors have to be invested in their customers, and their customers show their appreciation by going back continuously.
But heart surgery isn't elective. How can the market work?
You find the best heart surgeon. You look for customer reviews. You look at someone's academic history.
How do you pay for it?
Well, I mean, you have insurance. You're supposed to have insurance for catastrophes like heart surgery. That's what insurance was designed for. It wasn't designed to pay for 80% of every single minor medical kerfuffle you might stumble upon throughout the year. It's really supposed to be for those life-saving things. In fact, I asked Dr. Day, because I spent a year without health insurance because I have celiac disease and couldn't get it. The system is not perfect, trust me, but when I didn't have insurance, I had to go to my doctors and say, all right, what will you charge me since I'm outside the system? And we worked together. She said her father was
the doctor gave you a discount.
Dr. Day said her father, who was a physician, taught her, people who can pay for it, they'll pay in full. People who can only pay a little bit, they'll pay a little bit. Some people can't pay, you help them out. She said she would have negotiated a rate with me outside of insurance.
And in this little area of free market medicine, what's happened to the prices is interesting. The quality of LASIK surgery keeps improving, and the prices have come down 25%.
And the technology keeps improving because customers demand it. And when you have that sort of influence from what people really want, it's going to make the service better. Cosmetic services, they've only gone up by 23%. Inflation by 59%. Medical services have gone up by 108% when compared with one another.
You want to escape America's government-dominated health care and save money? It's not hard. Just leave the country. Go to the Philippines.
It's not just their brilliance that makes Filipino doctors popular, it's how well they treat their patients.
Go to Colombia and get pampered.
I will send a chauffeur to the airport, and he will take you to the hotel where a welcome package and a mobile phone will be waiting for you. Once we take care of the medical part, we can pamper you.
Go to China.
Shanghai is also an outstanding destination for affordable, high-quality healthcare services.
Coming to China for my operation was the best decision I could have made.
This is called medical tourism, and in many places you can get medical treatment for much less than it costs in America. And Americans go. Last year, more than 1 million left the country to get cheaper treatment. But why do they have to leave the country? Can't we find something similar in America? Yes, we can, says Dr. Keith Smith, Because he's founded a surgery center in Oklahoma that charges much less. So how?
We own our facility as physicians, and so we, by virtue of that arrangement, have cut out the most inefficient and greedy profit seeker from the equation, and that's the not-for-profit hospital, to be honest.
And for the most part, your customers, your patients, pay themselves or are insured by a company that self-insures. It makes for a different relationship?
Yes, we put our prices online, and the first patients that showed up... Post them online, and the first patients that showed up, interestingly, were the Canadians. But the patients that come to us now, our fastest growing part of our business, are employees for whom the employers pay for their care directly out of operating expenses.
And the Reason TV really recently posted a video clip about your surgery center. Let's watch a bit.
June Wiskoski is about to undergo a simple procedure to relieve her carpal tunnel syndrome.
Are you nervous?
A little bit. I think I'm more nervous about being put to sleep.
What makes this routine surgery so unusual is that the total price, which comes to $2,750, is posted online.
We decided we would have price honesty.
Why don't we have that in healthcare?
Because there are a lot of people that benefit from dishonesty in pricing. We put our prices online with the hope that we would attract more patients and more business, but also hoping to start a price war, a real deflationary price war that could bring prices to a level that people would reevaluate their need for insurance altogether, and certainly reevaluate the role of government in healthcare.
And the price differences are enormous. Let's play another clip from that Reason video.
The surgeon was Dr. Jason Sigmund, who also does the procedure at the Surgery Center of Oklahoma, where the total price is $5,885. The bill from Integris comes to more than $33,000. Dr. Jason Sigmund regularly performs procedures at both the Surgery Center and at Integris Baptist Medical Center, which is the epitome of a traditional hospital. Sigmund says the Surgery Center is so much more efficient than Integris that he can perform twice as many surgeries there in a single day.
We have pressures to do that because the amount that we get reimbursed for the same case that they do at the hospital is such a fraction that we're really forced to be efficient.
And Integris is the big local hospital there, and these surgeons who you employ, they work for you and for the hospital.
They don't work for me. They're independent physicians.
Right, but they do surgery at
Yes, at both places.
And $5,000 versus $30,000?
Yes. And the insurance companies, a lot of them drive them to the larger facilities where it's more expensive. And that was one of the things that drove us to put our prices online, was to expose that problem.
And the result is that some people, because they have a deductible, they come to you, they pay it out of their own pocket and still come out ahead?
Yes, people that have high deductible plans, health savings accounts, like I said before, people that are part of self-funded plans, they have the sticker shock, so they're shopping. They're true consumers in the market.
But insurance seems free, and I'm on Medicare. They don't even ask me what things cost. If she has to pay $3,000, how does she come out ahead?
She came out ahead, this patient did, because her employer paid for the whole thing. Otherwise, the hospital would charge them 6, 8, 10 times that. So the employee didn't have any out-of-pocket.
The employer was so happy that it was cheaper, they said,
we'll
we'll
pay the whole thing.
Forget the deductible.
Yeah.
Now, one of the reasons there's less competition is in most states, there's this law called the Kahn Law.
Certificate of Need.
Which means that if you're going to build a hospital, you have to prove to the bureaucrats that it's needed.
It's not just hospitals, it's surgery centers, MRI units, you name it. And so it's old-fashioned protectionism. It's old-fashioned crony capitalism.
One result of your posting your prices is that the hospital, too, has started coming down in price.
Well, I get between 5 and 7 emails every week from patients that said, we were going to come to your facility from Florida, but our local hospital surrendered to your pricing. So we're saving people money all over the country, and we're not even doing the surgeries many times.
And just by saying we're here.
Right.
But you're growing. You've got 47 surgeons, and you may soon have more?
I think we will. We're expanding our facility. We're going to add 2 more operating rooms, so we'll be able to do a lot more surgery than we're doing now. And I think the way things are going, that's going to be needed.